From the News Channel 5 Network, this is MorningLine with Nick Barris.
Good morning, everyone. Thanks for joining us on Morning Line. I'm Nick Barris coming to you on this Wednesday. A good show on tap. A lot happening in the city of Nashville and in the state of Tennessee as a whole, really. And we're going to touch on all of that this morning with a couple of guests throughout the program. We're going to start first in a moment here talking about the very latest with COVID. With regard to what's happening in the city and where we're seeing the spikes and the increases in the more rural areas right now. And also, in case you haven't been recently, what you can expect with the swab tests now, since there's still some of the longer stemmed ones and the shorter stems that doesn't go quite as deep, all of that. And we'll touch bases on where we stand with regard to a vaccine, okay, which is still, it looks like, a ways away. And then later in the program, we're going to transition. We'll be joined by a professor from Vanderbilt to talk about a little more what we're expecting for the debate tomorrow night, different facets of that. And as always, we'll invite you to comment or ask questions as we go along. We're going to be streaming live on Facebook as well at newschannel5.com if you want to go there. In fact, I'll go and make sure we're up and running right now. And when we are, you can message me on that, and I'll try to answer that. You can also call in as always. We'll get the phone number up, but with no further ado, let's introduce our first guest of the morning, and from Meharry Medical College, Dr. Calvin Smith. Good morning to you, sir. How are you?
Good morning, Nick. I'm great.
It is good to see you, and we'd like to have you come on periodically because I know you're very involved with what's happening with COVID and the testing and all of that. And, you know, we've seen changes coming. We're embarking now upon the cooler time of the year, the flu season, which everyone talks about. Wow, imagine flu and COVID at the same time. And we're seeing, you know, spikes now all of a sudden. Is this something that we expected?
Yeah, it is something we expected. Unfortunately, we were hoping to avoid it, but it looks like we are in full bore, and it's going to be a long winter.
And is this spike, what do you attribute it to? Is it that things are getting cooler, so people are going to start staying more indoors? Is it that every time we see some positive news where the numbers go down, people all of a sudden think, oh, well, it's back to normal, off with the mask and no more social distancing? Where is the problem happening?
I think it's more of the latter. I think that, you know, we have had some success, some flattening of the curve, so to speak, and we've seen the numbers go down, and people haven't had it in their faces much. You know, they haven't been around sick people, seeing sick people. And so, you know, we kind of let our guards down a bit. There's a lot of mask fatigue, a lot of COVID fatigue that we kind of talked about before, but, you know, people are over it and don't think it still exists, and it's showing us that it still exists, and it's back to where it was basically at the beginning of the virus.
Okay, and that's, yeah, the numbers that we see in terms of the emergency room beds and everything else are some of the worst that we've seen. And it's not just now, but we should say that it's happening at least in Tennessee now again, and it's made its way into some of these more rural areas, which early on seemed a little bit more insulated. Cities like Nashville, while by no means is it behind us, we've seen some modest improvements. We're not in the red on everything right now, and I don't know if that's just because the city's got the mandate still in place and other places aren't doing it. What do you attribute that to?
Well, you know, I think the city is starting to show an increase, and you know, yesterday they had the release, the joint release from St. Thomas, Vanderbilt, and Meharry, where our ICU beds are starting to fill up again, and it's actually, you know, and looking at the numbers, we are actually a little bit almost the same, if not worse, than where we were this summer in terms of ICU beds and in terms of things like that. So the city is not out of the woods by any means. You know, we were doing a lot better because of the mask mandates and because of the you know, the social distancing and everything like that. But just from my little casual encounters in the city, the things that I've been doing around the city, it's relaxed. People are a little bit, you know, our guard is down, and we're seeing a reflection of that.
Okay, yeah, because, you know, I've been out a bit. You know, I don't stay home all the time. I'm very cautious where I go, but I tend to see that a lot of people in the places I go, masks are, you know, quite common. You know, I see a few without them, but it's got to be in places where I don't go where it's happening. You know, if this continues like this, then then what happens as time moves on? By the way, the NBA Finals just finished, all right? I don't know if you follow the NBA. I'm an NBA fan.
Oh, yeah.
And so as well as I do, they played in a bubble. They went through this all more than any other sport, really. The NBA had no problems with COVID in this bubble. So, look, folks, we know exactly what works. Okay, if you're someone out there that doesn't think a mask or social distancing works, you are a fool, all right? It works. We know it works because we saw the NBA, these players on the court, close contact, everything. Not a single case throughout the whole NBA playoffs with all those teams, staff, and everything. It works. So, that's what's so frustrating. We know it works if only people would abide by it. Is it that simple?
It really is. And the thing about it, Nick, is that the NBA's effort was coordinated with a lot of discipline. People were adhering to the rules pretty strictly because the consequences were pretty tough for them. The leadership of the NBA was steadfast. When there were any kind of breaches, I think there was a gentleman that brought a young lady into his room or something along those lines at one point, and he was out of there. They didn't play around with it. But the NBA has vast amount of resources that are controlled in a way that is very disciplined. And that's what it's going to take.
Well, so when you look at the landscape, then I guess where we stand now, if we continue on the path we are, just paint the picture for me on how ultimately, things will develop as we move through, the winter months, as I guess, and we're going to touch on this later, we wait, hopefully, eventually, for some type of effective vaccine.
Well, I'll start with the good news. The good news is that, at least from my view and my patients are much more enthusiastic about getting the flu vaccine. And especially, I take a lot of time now to explain what exactly the flu vaccine is, how it is a protein and does not cause the infection itself, things like that. And so people have been inoculated with the flu vaccine, and that will definitely help during this period of time. That being said, in the winter months, like you alluded to, people are going to be inside more. They're going to be, they're going to be getting other types of colds because the flu is not the only type of cold. The actual coronaviruses 1 through 18 before this were also some of the forms of the common cold. So people are going to be eating those kind of things as well. And I see this going not quite as bad as what we thought, with 2 million deaths or anything like that. But, 200,000 deaths already, it's climbing to like 225,000 deaths now. It's going to continue to creep at that pace. And people are still dying, and people will still probably, if we're going at the rate we're going and with the ICU beds going where they're going, it's going to be difficult. Even with the number of ICU beds and the ventilators that we have available to us, the people that have other conditions like heart failure, that have, cancer, that need ICU beds for other reasons, they're at higher risk of developing COVID as well. So we'll see some overlap there too.
One of the fastest growing segments of the population getting exposures, right, are some of the younger crowd. I think the number now is in the 40s and maybe even some people younger than age 40 that are the fastest growing. And in that category, are we seeing, though, because they're younger, yes, they're getting infected, they're part of the statistic, but they tend to just isolate at home, and many of them, though, do recover?
Yeah, we are seeing that a lot of the people that do isolate at home do recover. But the reality of it, Nick, is that there are more people out there probably that have been exposed that don't know that they've been exposed. And, they are the younger people that are not having symptoms, that are doing exactly what the opposite of what Dr. Hildreth recommends and being a vector. The younger people, if you continue to quarantine like we did in the beginning, 14 days of quarantine, all those kind of things, it's very, very unlikely that you'll transmit the disease to anybody that's not exposed to you. And the people that are aware about it and are being tested, generally, those are the people that are doing the things that they need to do. But the general population, most people are feeling a little bit safer than I think they should feel.
Yeah. I'll tell you this, as we go to the break, and when we come back, we'll take our phone calls and the like. I do think because of the steps I've taken, and I know that you take, every cold and flu season, I tend to get sick at least one time every winter. It just happens, even if it's not the flu. But the steps I'm taking to protect myself, hand sanitizer, washing when I can, wearing a mask and social distancing, I think is going to protect me not only from COVID, and I did get a flu shot, but from the flu, any other cold out there. I think I have a better chance at maybe staying healthy this winter if I stick by these things that we have in place right now.
That's what it's all about. There are no guarantees about anything at all.
Yeah.
But you definitely can increase or decrease your odds based on your behavior.
Yeah, that's and you make a good point. The truth is, too, you can do everything right. And I have some friends of mine who I know and trust that have, and they still got exposed. There's ways that can happen, but you can definitely take steps to reduce that risk. Listen, we'll take a break, Doc, and when we come back, we've got some phone calls for you. We'll continue our conversation on the latest on COVID and get your thoughts on the vaccine right after this.
All right.